Ladies and gentlemen, uh, hello to everybody. My name is Tomislav Benjak, and I am head of Department for Prevention Disability in the Croatian Institute of Public Health. And I will say you something about Frailty and the European project on that area. Also, I tell something about what we have in Croatia plan in the next period on that area. For the beginning, um, for some background of that field, I have to say that aging is one of the biggest challenges that Europe is currently facing, according to World Health Organization. Demographic trends suggest that there will be an increase in age-related disability and dependencies, which will ultimately impact not only on the well-being of the individuals affected, but also on the sustainable of health and social care systems. Recent data suggest that disability and dependency can be changed, providing the opportunity for older adults to live longer, healthy lives. For most older people, the maintenance of functional ability is of the highest importance. Healthy aging is defined by World Health Organization as a process of developing and maintaining the functional ability that enables well-being in older age. Therefore, identification of conditions preceding the development of disability and dependency is an essential thing to effectively promote healthy aging. Among the most important of conditions that contribute to functional impairment is frailty. For beginning, I have to say what is a frailty according conclusion of our European project. Frailty is in the inevitable decline in the psychological system that results in decreased reserves, confers extreme vulnerability to stressors, and increase the risk of a range of adverse health outcomes such as disability, institutionalization, hospitalization, and death. That definition is according to World Health Organization. Frailty is also potentially modifiable condition that can regress to a robust non-frail state, especially in its early stages. Frailty is also a reversible state whose early identification and main management is central to avoid disability. There is evidence that prevention and early management of frailty can avoid many of the major negative health related outcomes associated with aging, including functional decline and dependency. Nevertheless, although addressing frailty is a necessary step to enhance healthy aging, frailty is not currently considered as a public health priority in many European countries. Concern over this situation motivated the European Commission and many of member states to co-found the first joint action on the prevention of frailty, and name of project was Advantage. How common is frailty? The prevalence of frailty mainly depends on the setting where the study is carried out. On community cohort samples, prevalence ranges from 2 to 16 depending on the aging of the evaluated population and the frailty assessment tool. The Advantage meta-analysis of European community-based studies confirmed an estimated prevalence of 12%. What are the consequences of frailty? Frailty can have an important impact on affected individuals, their families, the health and care systems, and society. It is associated with a greater risk of adverse health outcomes such as falls, hospitalization, disability, and death. How can frailty be prevented? It is important to encourage healthy behaviors such as increasing physical activity and decreasing sedentary behavior, reducing smoke and alcohol consumption, and improving diet to achieve and maintain healthy weight in middle life to improve health and reduce the risk of frailty in later life. The Mediterranean diet, characterized by high consumption of nutrition, foods such as fruits and vegetables, whole meal and oil fish, but low intake of saturated fats may also prevent frailty. There are many observational studies showing that social factors such as level of education, income, and marital status may shape the development of frailty. How can frailty be screened? Many instruments have been proposed to screen for frailty. In the absence of gold standard, the instrument to screen and diagnose frailty should be chosen according to the characteristic of the population being studied, the aims of the assessment and context. The Advantage Joint Action proposes the use of screening tools fulfilling the following four characteristics: quick to administer, do not require special equipment, have been validated, meant for screening. These characteristics were met by following instruments, for example, the Clinical Frailty Scale, Edmonton Frail Scale, Fatigue, Resistance, Ambulation Illness, Loss of Weight Index, etc. How can frailty be diagnosed? As the purpose of diagnosing frailty is to prevent functional decline and disability, assessing frailty status is a controversial issue in a patient with established disability. Frailty status in older adults without disability should be determined using a validated scale. The purpose is the following as a frailty diagnostic instruments: a validated frailty index based on the cumulative deficit model of frailty, the frailty phenotype of cardiovascular health studies, or the frailty trait scale. First and second scale allow tracking of the evaluation of frailty. How can frailty be managed? The next step after the diagnosis process is the management of frailty. To properly manage frailty at the individual level, a comprehensive geriatric assessment should be undertaken, followed by an individual care and support plan which address current and anticipated needs and care preferences, includes advice on physical activity, reducing risk of falls, adequate nutrition, review medication, vaccination, and considers the support needs of carers. And finally, what is the Croatian experiences and future plan in our state? In Croatia, we haven't any experiences with that area, with frailty. So, Croatian Institute of Public Health was a partner in Advantage project in activities for definition frailty and screening tools. In light of fact that is the first time that we have in a use term of frailty in Croatia, for beginning, we have start with education, health professionals about all aspects of that term. So this conference is the best way for start. Thank you very much.